Well, if you're like most people, you probably want to start off the new year taking better care of yourself, and that can begin with healing old injuries or addressing pain. Here with us now with how you can get on the path to healing is Dr. Colin Elkins, physical therapist at Robotic Precision Therapy Clinic in Troy. Good morning, Dr. Collins. Thanks for being with us.
Thank you for having us.
So tell us about robotic precision therapy. What are the benefits, and who is this type of therapy designed for?
So this type of therapy is designed for, patients who are kind of been at their wit's end. They've seeked out other therapies, they've tried other things, and they're just looking for something new, something fresh to kind of, hopefully get them over that hump that they need to get better.
And Dr. Elkins, can you give us a sense of what this therapy entails? What does a session look and feel like?
Yeah, so the robotic arm applies pressure, static pressure, for about 10 seconds. And the beauty of it and the difference between other therapies is that it does what a physical therapist or what most people can't do physically. It applies about 30 pounds of pressure at a max, and it holds it for extended periods of time. And if I tried to do that over and over throughout my day, I would probably break down pretty quickly with my hands.
Right. And I'm curious, is it painful at all?
Ranges from people have fallen asleep on the machine because they find it relaxing and soothing, but some people do find it a little bit of find themselves in a little bit of discomfort.
And do you have ideal candidates for a therapy like this? Is this ideal for someone maybe recovering from an injury? Are there ages that this type of therapy is designed for?
We see people as young as children's age, and we see patients all the way into geriatric age. There's a wide variety. We see all kinds of patients, from athletes to average Joes to just people trying to get rid of aches and pains.
And about how long does the therapy take? Is this like session by session?
It usually takes about 1 to 10 visits. We try to see patients at least once a week to get some, consistency in the treatment so that we can build on the treatments before.
And for those who maybe might not feel comfortable going into a clinic setting right now with COVID surging around Metro Detroit, are there some things that your patients could do at home to try to promote wellness and ease some of the chronic pain they have?
Yeah, absolutely. One of my biggest things, a lot of us are working from home, and a lot of us are working at desks that really aren't meant for our bodies to be in good positions. So my biggest thing is just for patients or people to watch their posture. Open up the chest, sitting up tall, getting up and moving a little bit throughout your day and not sitting so long. I like to tell people to set a timer for about an hour to get up and move about every 60 minutes.
Yeah, that's a really good point, especially with so many of us working from the kitchen table in the living room. It's something we probably don't think as much about. And before we let you go, Dr. Elkins, where can people learn more about RPT and the clinic?
Yeah, you can go to rptclinic.com and you can find out all our information there, where to find us and how to give us a call.
And I assume for appointments, call to schedule, do you have to go online? What's the best way to book an appointment?
I believe you can call or email.
Fantastic. Dr. Colin Elkins, physical therapist at Robotic Precision Therapy Clinic in Troy. We appreciate that insight, and thanks for joining us this morning.
Thank you for having us. Happy New Year.
You as well.